Topic this morning is the welfare debate, and we're talking to Miss LO'Neal3, who is the Executive Director of the Conference on Social Welfare for the state of Tennessee, and Miss Linda O'Neal, who is the Executive Director for Children and Youth for the state of Tennessee. And Miss O'Neal, before we had our break, we were talking about Congress and welfare, and Miss Moynihan had given us some information in reference to the early history of welfare in the state of Tennessee. But looking at some of the proposed changes and some of the things that are going on in Congress now, what can you say from your seat as the Executive Director of Children and Youth for the state of Tennessee? What can you say about some of the things that are happening in the welfare debate at this time?
I think we have to recognize that everyone wants welfare reform. Most of all, the recipients would like to see welfare reform. What we have to be careful of is that the cure for is not worse than the current disease. In Tennessee, 2 out of every 3 recipients of welfare are children. We need to remember that it's Aid to Families with Dependent Children, AFDC, and the C does stand for children. The payments in Tennessee are very low. A mother and 2 children, and that is the typical AFDC family in Tennessee, receives total cash of $185 a month. That's less than half the national average, that's $393 a month. So we're not talking about a lot of money individually for these children or even collectively in the state budget. But we are talking about a small amount of money that makes a critical difference for these children and families. In Tennessee, AFDC payments only account for about 2% of the state budget. At the federal level, they only account for 1% of the budget, and yet with all the rhetoric you hear in Washington, you would think that welfare alone was primarily driving the deficit. It clearly is not. That doesn't mean we shouldn't address it as a problem. It means we need to be careful in how we do that. We know that most of the mothers in Tennessee have low income, low education levels, and obviously low income, and many of them have real serious educational and job readiness deficits that need to be addressed through training and through preparation so that they can enter the workforce. But the greatest concern we have for children is whether or not there will be adequate child care for them while their mothers work or while their mothers are in education and training. Good child care is expensive, but it's also very important. We know from studies that providing quality early childhood education is one of the best ways to break cycles of negative outcomes. Studies have clearly shown that for every $1 we spend on quality early childhood education, we save $7.16 in avoided payments for issues like school dropout, for special education, for teen pregnancy, juvenile delinquency, long-term unemployment, and welfare dependence. So as a part of welfare reform, we've got to focus on children and ensure that we have child care to meet the needs of children when their mothers go to work. It's particularly a problem in the evenings and on weekends. Many low-income and many low-skill people can only get jobs that are at night or they're on the weekends in retail and in other kinds of industries, and the availability of child care then is extremely limited.
Very good. You know, Ms. Moynihan, I think that in dealing with all of the organizations and individuals that you're dealing with across the state of Tennessee, what are you hearing from these organizations and individuals in reference to their attitude about welfare and what impact they believe? Now, whether or not it will happen or not, it's simply speculation on their part now. But what are they saying in terms of how they feel that the debate will impact upon them?
I think what I'm hearing the most, and this is from recipients as well as service providers, is a great concern about whether or not there are going to be jobs for the people that the new plan says we're going to put everybody to work. Not everybody's ready to work, or not everyone can work if there are no jobs. We don't have a job development system here in Tennessee. That's absolutely essential if we're going to meet the target numbers that are mandated in either one of the bills. The other problem is, again, as Ms. O'Neal said, appropriate, affordable child care available to these parents at the hours they need them, as well as transportation. We have so many families who now receive AFDC who do not own cars or even have access to cars. So how, in our rural areas, where at least a third of the AFDC population households live, how are they going to get to a job, There is no bus system there. And even in our major cities in Tennessee, we know how inadequate our transportation systems are. So again, from the recipients themselves and the service providers, great concern in these areas, plus concern about how local communities will deal with the people that are going to lose any benefits. Here in Tennessee, we're hearing discussions from policy advisors in the governor's office about limiting a Tennessee welfare program to a year with some exceptions to for an extension up to 6 months. Well, a year is a very short period of time. And again, whether or not we can find the jobs for the people, it doesn't matter if they want to work, whether or not they actually go to work. It seems as if they would be cut off the rolls if they didn't have a job after that year. So we have major questions about some of the policy considerations, not decisions, but considerations that are going on here with the state administration. Now, we do have one area that we are very pleased with, and that was the legislature last year passed a new law for Tennessee related to welfare programs specifically targeted to AFDC, saying that before the Department of Human Services could implement anything other than the very technical requirements, but before they could implement anything that is, Congress says, can be a state option, they would have to come back to the legislature, report what the plans were, and again, get it more or less passed by the legislature. That may be the only way, or the only public hearing that will be held related to all these things, which many states are right now in the process of developing principles for transition and for welfare reform in their state. We have a meeting coming up, or by the time this taping is shown, it will have passed, but at which we're going to discuss whether or not we should develop some of those for Tennessee. About 15 states have done this so far.
Very good. And I think, Ms. O'Neal, you've indicated already that when we talk about welfare, we're talking about such a very small proportion of the state's budget, yet still there's quite a bit of controversy about it. And we want you to expand upon that and to give us some additional information in reference to that when we come back after our second commercial break. You know, we've got to make sure that we don't interrupt a good flow of conversation here, and we do want to wait until after the second break. But we do want that information because I think that very few people recognize such a small proportion of the money actually goes for welfare. And we'll be back with you following this commercial break.